Hey, can we just go straight to southeast Queensland, because we're seeing these figures and the fact that so many children are contracting it and that it's linked to the various schools. What's your take on it?
Well, it's a reflection of the fact that the Delta does seem to be drifting into younger age groups. Before the school holidays in Britain, I think the week before the school holidays, 640,000 children in England, I think it was, rather than the whole of Britain, were on furlough, either because they had COVID-19 or they were a primary contact. So it is a spreading group, and it really does need to be taken seriously. It's partly because the older people have been immunised and it's drifting down, but it may have a predilection for younger people. And the issue here is, should we change our vaccine rollout, the priority there? Last night on 7:30 I had Emma McBride from James Cook University on, talking about that, where and they've done the modelling, and her view is that you do the vulnerable groups, which is the over 60s, get them done, but actually then focus particularly on the teenagers up to about the age of 30 or 40, because those are the people who are catching it and transmitting it. So controlling hospitalisation and then controlling the majority of the biggest groups who get the infection would be the most useful strategy, as we're short of vaccines. And that group is exactly the group that's twiddling their thumbs waiting for the Pfizer doses.
And you've made the point in the past, Norman, that if kids aren't vaccinated, they risk getting seriously ill on a long-term basis. Other doctors, epidemiologists have made the same point. But we go back to, again, at this stage, at least, the lack of supply, particularly when we're speaking about Pfizer.
Yes. But you could, the possibilities there is to redirect the supply that you have towards that. So partly they've done, just a clarification of the severe disease, it's still the case that children are far less likely to get, just to reassure parents, are far less likely to get severe disease and die. But young people and children do get long COVID, and I think that's what you're really referring to, and that's what you don't want to happen. And yes, you could redirect the supply, which is to some extent what they've done in New South Wales, but for a different reason. They're immunising Year 12 students, and they're getting a bit of pushback from other parts of the state there. But if you follow Emma McBride's thinking, that's you get kids back to school, but you also start to immunise that younger group.
And what do you think about the approach in New South Wales of relying on vaccinations as the way out?
Well, this is the first time. It's a very different. So this is now the New South Wales second wave. Let's start calling it that. But it's a very different second wave from Victoria, because they've got good contact tracing in place. I mean, Victoria does now, but didn't then. It's a new variant, which is much more infectious. But now, and you've got lockdown, which is probably not quite as universal as Victoria's was. And the compliance, according to Sydney University, is not as high as it needs to be to bend the curve. But now you have the added benefit of vaccine there. And I don't think this has been tried anywhere else in the world, where you're trying to use vaccination to curve an outbreak. And in a sense, New South Wales, the residents of New South Wales are or at least Greater Sydney, are guinea pigs in this, to see whether or not, if you can really intensify vaccination, can you bend the curve downwards, or at least control it, because the contact tracers are losing control of this. They're really behind the 8 ball here. It's not their fault. It's just too many infections, and the risk is that you get a tip over, and you get much faster exponential growth. But the good news here is that you could get a bending of the curve with the combination of vaccination and lockdown.
And let's stick with vaccination. We have the National Cabinet targets of 70, then 80% before we're getting back to anything resembling normal life in Australia. What are your thoughts? Is that 70% achievable by Christmas in your view?
So 70%, let's just be clear, is the over 16s. The number that we've really got to focus in is the total population, because it's the total population that the virus circulates. We're just talking about kids here, kids who are not eligible for vaccination. So it's the total population. It's 56% actually of the total population, which is roughly where Britain is now, and they've seen a major Delta outbreak with hospitalisations and deaths going up, albeit at a lower level. So the modelling that I've heard about in terms of the current vaccine rollout would have us there in December. The ABC's data journalists would say that at the current rolling average rate of about 1.2 million doses a week, we get to full immunisation around about January of next year, which is starting to look more optimistic. So we could get there. The Prime Minister is careful about not setting targets. But most people I've spoken to who know what they're talking about in this area say you cannot open up even at 80% of the whole population, because that's only, 65% of the total population. We've got to get to 80 or 85% of the total population. So what we've got to do is get to 95% of the over 60s. I'll repeat myself of what was said before here. If you're over 60 and watching this, get your Astra. There's too many people over 60 who haven't had their Astra dose wherever you are in Australia. Get it done. Don't wait for Pfizer. And we've got to get to very high levels of the rest of the population to get to where we need to be to really open up. Now, the paradox here, it's an ironic paradox, is that New South Wales could be the first state to achieve those high vaccination rates. And it could be the first state to open up to international travel, again, paradoxically, because if they had the intensity. And that could show the rest of Australia, if the Commonwealth Government were prepared to let it happen, that could show the rest of Australia the advantage in getting vaccinated.
Okay, to the over 60s out there, listen to Dr. Norman, okay?
Get it done. Even if you're pretending that you're not over 60, just do it.
And look, Jay over 58.
You pretend you're not over 60, Norman, but I know exactly how old you are. Anyway, we'll talk about that later.
Norman Swan, thank you so much for coming on.
Yeah, get insulted every time I come on.
That came free. It's an incentive.
I got the look. I'm in trouble. Norman, thanks, mate.
You're welcome.